欢迎来到 PCE Club 5月的线上聚会，我是 PCE 的义工小松球。先占用一点点时间，介绍一下我们今天月会的形式以及 PCE Club。这次月会的预计时长是2个小时，前1个半小时会由义工景山和 Alice 对我们今天请来的嘉宾资深的精神科医生王莹医生进行访谈。最后的半个小时会开放给现场的观众进行问答。在提问环节还欢迎大家踊跃发言，贡献您的宝贵问题。那我也想借这个机会向第一次接触 PCE 的新伙伴们介绍一下 PCE Club。PCE Club 的中文名叫做父母子女教育俱乐部，是成立于2003年的由新泽西的5个华人家庭发起的非营利、非宗教、非政治的教育组织，致力于为华人家庭在育儿道路上提供一个抱团前行、互帮互助、少走弯路的讨论平台。我们注重情商教育，而不是成绩，关注孩子的心理健康，注重理解孩子，用同理心来增进亲子沟通。18年来一直坚持学习和宣传情商育儿，并且践行育儿育己、成长及成功的理念。我们的目前的主要活动为每个月第2个周六的月会，内容会围绕着情商育儿、自我成长和身份认同，以及青少年实话实说这4大板块展开。在每年的10月份会进行大型的教育研讨会，聘请教育界的专家学者来亲临指导。如果想了解更多我们的活动信息，以及收看往期的精彩回放，欢迎移步我们的网站、YouTube 频道以及我们的公众号。如果你也想加入我们这个大家庭，欢迎扫码我们的微信助手。这些是我们近期举行过的活动，以及我们即将开始的课程。最后，我想占用一点点时间，给我们明天即将开始的静心课打一个小广告。最后一天的报名机会了，如果你也跟我一样，经常感觉到好像学了很多的育儿知识，但是面对冲突或者遇到挑战的时候，就是使不出来这些学过的本事的话，那不妨来尝试一下静心课，帮你找回你的内在稳定，有更大的心理空间可以支持帮助到孩子。那下面我把宝贵的时间交给金山。
那我来简短介绍一下王莹医生。王莹医生算是我的老朋友了，或者说其实我是他的粉丝。他来 PCE 讲过几次，但是呢，我们之前比较遗憾的就是说每一次我总觉得没给他足够的时间。就是他王医师的背景是就是精神科医生嘛，他是在耶鲁大学的医学院就是拿的那个就是 MD， 就是医学的那个学位，然后后来是 residence 是在MGH 就是 Mass General Hospital 和那个是全国排名对全国排名第1的，应该是非常有名的一个医院。然后他是哈佛医学院的叫做 affiliated 哈。然后他在那个哈佛医学院residence 的时候，我看到他是好像还不是一般的 resident， 是那种 lead 是吧
？Chief Resident，
总住院医，然后也在那个 Harvard Medical School 教课是吧？
对，
然后其实他以前来的时候分享过一些别的方面的，比如说大学毕业的时候其实是去华尔街工作了，后来那个希望就是活出一个更符合自己内心那种意义感的那种找那种方向，然后转而去这个医学院学这个精神科，就是希望能够在我看来他就是想要去看到很多人都在受到各种各样的挑战冲击suffer， 就是受到这些折磨，想要去帮助别人，想要去这个修补世界吧。反正在我看来就是王英就是其实很符合我脑海中想象的那种，就是说好的教育出来一个人他是个什么样子，那种我的那种想象就是那种知识面也很宽广，然后对很多问题都 都有比较深的认识吧。然后也有很多这个 compassion， 就是那种爱心、同情心，然后跟人打交道的界面也很友好，而且非常聪明，跟他互动就是你问他问题，他马上回答，就是脑子很快。然后就是
这下子我压力太大了。
没有这些词你当然你是不好意思自己说自己的，这个我说你吧，我也不带夸张的，我是真的是这么想的，我在说。所以我们今天非常有幸啊，非常高兴能把文医生请过来，就给他比较多的时间，让他充分的去给我们多讲一些东西。然后中间可能Alice 和我可能会中间穿插一下来提个问题，或者是稍微对话一下。
谢谢景深，谢谢这个 introduction， 这个让我真的是非常的感动，也很激动。这样一感动一激动，我中文就表达能力就有一点问题。我非常的荣幸今天能有这个机会，能有这个平台来跟大家一起讨论，就是心理健康方面的问题。作为一个母亲，我觉得从 PCE 各种活动中，我也受益匪浅。我第一次碰见景山，好像是在那个 Chinese school。那个还是好几年前，你在那边发散传单，然后那个时候我带我孩子去上课，然后当时一下子谈话当中就发现，其实你对心理健康是一个爱好者，然后慢慢从那之后，我接触到这个 PCE 各方面的活动。你开始说就是我从 Wall Street 转到心理学好像说是修补世界，我觉得更重要的是修补自己，找到就是真正适合自己的这个行业，然后同时能做一些 contribution。所以说现在我能有这个机会来和大家分享我的专业知识，能和大家一起学习，一起成长，真的对我来说是特别有意义的一件事情。所以我要非常的感谢 PCE， 感谢这些 volunteers， 感谢景山和 Alice 这一次在开这会之前跟我一起 go through some of my slides， 给我一些 feedback， 也感谢所有来参加这个会议的朋友们。我希望我们一起来学习，一起来成长。
那我说几句，就王莹医生他是应该差不多11岁左右来到美国的吧，所以他的中文其实讲的是很好的。不过他的医学方面的术语，什么心理学方面的那些术语都是用英文学的，他对这一块的中文就不太熟悉，所以有些东西他可能会用英文。
OK， 我们今天呢，我 cover 的内容稍微有一点广。一方面是因为我被布置的任务是给大家做一些心理疾病和治疗途径的科普，让大家对这个专业心理治疗有一个比较 organic 的认识，以及包括一些就医的 logistics。另外一方面呢，我也想给大家一些具体的 self-help skills， 而且比较着重的讲 CBT 和 DBT 这两个是景山和 Alice 都比较希望听到的，所以呢，covering a lot, it's a little bit ambitious. I will do my best. 如果哪一些 topic 大家比较感兴趣，希望多讲一点的，大家可以maybe type in the comment box. We don't have to cover everything. 如果有东西没有来得及讲也不要紧，但是我就要想比较就是灵活的，大家什么感兴趣的我就多讲一点 ，OK？ And also please be patient. 一开始如果对你来说太基础了，太 basic 了 ，there's going to be good stuff later on. So just a quick outline. We'll start with what is mental illness and how do I know if my struggles are pathological? How do I talk to my family members and friends who need help? What kind of treatment settings exist and how do I access them? And then when it comes to treatment, I will talk to you a little bit about medications as well as therapy, focusing on CBT and DBT. Okay, so what is mental illness? 精神疾病它其实就是影响一个人的思维、情绪或者行动的一种疾病。它不是性格缺陷，也不是 weakness. It's not something that you can just pass with time or get snapped out of it with willpower. There's a variety of different types of psychiatric illnesses. 像抑郁症啊、焦虑症呀，像双向情绪障碍等等。我常见的到我诊所来常见的可能就是属于 depression, anxiety, OCD, bipolar, psychosis, PTSD. As you can see, a huge range. 并不是说我有了精神病，我有了精神病就代表我 crazy. No, there's a huge range of different disorders. Specific causes for psychiatric or mental health issues are not really clear. But what we do know is 就是各种各样的因素它会增加精神疾病的风险，包括像家族史、general physical health condition, significant life events such as a past experience of trauma, loss, death of a loved one. All of these can potentially be risk factors. One of the most common reasons for people to come see me is depression. 抑郁症是非常非常的 common and very treatable. Yet, 35% of adults who need treatment for depression do not receive it. So, depression, what does it look like? 它到底是个什么样子呢？情绪低落。
我打断一下，就刚才你这个里面，有2点，一个是说，因为你是精神科医生，所以来看你的相对来说是重一些的，因为有心理咨询和心理治疗，
对，
就是那个 talk therapy， 就是只是谈话的那种，可能有些就是比这个要轻一些的，可能有很多是没有到这些双向
对，可能他的起步是 a therapist， 然后呢，可能当 therapist 觉得他这个比较严重的时候，可能会 refer to a psychiatrist， 就是到我这里来，是这样子的。但是也不完全这样子，也有就是 relatively mild symptom， 就是直接到 psychiatrist 这里来都有。但是你说的是正确的，很多人，大部分人，他如果是刚刚开始接触这个 mental health services， 可能他的起步是 a therapist, like a psychologist, a social worker, licensed counselor， 之类的。对。
然后上一张 slides 里边有一点我比较印象深刻的是，就是说35%，还有说25%的是那个人是处于 depression 的状态，是吧？
就是50%的 Americans at some point in their life will meet diagnosis criteria for a mental health issue, mental illness.
就是医生当中是50%，然后但是在任何一个时刻，我记得看到的说25%。
对，
那个数目吓了我一跳。
Yes, it's very very prevalent.
就1/4的人是有这个抑郁的。
对。
那你继续。
王医生，这个所以 pandemic 期间肯定有很多人焦虑和 depression， 有 depression 吧？这个
There was a
数字
huge uptick. Yes. So specifically, 它现在具体是在哪一个数字 I don't know, because this has changed because of now pandemic in a different phase from it was in 2020 and 2021. And, the surveys that have gone out, it depends on whether you're looking at symptoms of depression or actual diagnosis of depression. But what we do know is that there was a huge uptick in depression and anxiety and a huge uptick in suicidal ideation and substance abuse during that time.
Okay, thank you.
Yeah, good point. So what does depression look like? Okay, so the symptoms of depression, I think 我们大家其实都多多少少有经历过的，像情绪低落low mood, change in appetite, 食欲改变睡眠的问题 agitation, 情绪激动 fatigue, difficulty concentrating, etc. 这些症状其实我们大家都不陌生，但并不代表你有过这个就一定 meet clinical criteria. 下面我们会更具体讲一讲。Anxiety is another very common reason for people to come to me. So what does generalized anxiety look like? Well, these symptoms look familiar to us, right? 过分忧虑、暴躁不安、疲劳、肌肉紧张、易怒等等。那怎么样子来区别我们到底是经历的就是比较normal day-to-day kind of depression and anxiety or a pathological issue? And how do I know when I must seek help? Let's look a little bit more closer at that. 我们先看一看 normal sadness versus depression. Okay, the main things we want to focus on when we differentiate between what is normal sadness versus clinical depression are duration, 它持续的时间 severity 严重程度 and whether or not there's a specific trigger 就是有没有具体的触发因素 with normal sadness we might feel down for a day or two or even more if there's like a deep loss or some big unexpected event but generally we're still able to enjoy simple things and things that we normally do 比方说你平时比较喜欢听音乐看什么电视节目和大家在一起 socialize 这些事情你基本上应该是还可以正常的去进行的 but with clinical depression our sadness and helplessness is so overwhelming that often we don't find joy in these things that we normally enjoy. We don't find the motivation that we normally have. And our sadness and helplessness kind of encompasses everything, not a specific trigger. Sometimes there can be a specific event or trigger, but often we just feel down and sad and helpless generally about everything. All right, so clinical depression generally lasts 2 weeks or more. Usually it's much longer than that. And it interferes with our daily functioning. 它就是比较明显的、严重的影响我们的日常生活。而这种情绪它并不一定有这个 identifiable cause 或 trigger. And then the differentiation between normal anxiety and anxiety disorder follows a similar pattern. 就是正常的这个 anxiety, 它是有一个具体的 trigger. There's a starting point and an end point. Whereas anxiety and anxiety disorder may be triggered, but often it comes out of nowhere. And its severity, 它的严重性 can be very, very intense, 很强烈。然后呢，可能就是 out of proportion with the situation, 就是不成比例的。可能是一个很小的事情，但是你可能会非常非常的紧张，非常的惶恐。那 normal anxiety 正常的这个焦虑 sometimes can be helpful. 比方说你现在可能有点紧张，比方说我有一点点紧张，但是这种紧张情绪它不妨碍我来说话它 even it can motivate us to perform a little bit better. But anxiety from anxiety disorder typically is not helpful. It's dysfunctional and it interferes with our ability to function. 所以 again 就是我们看它的严重性，它的持续多久，和就是有没有这样具体的一个 trigger. So when should you seek professional help? You know, there are different types of professional help. If we're thinking about inpatient, 就是住院治疗，那它有一个就是很具体的 criteria， 比方说有就是人身安全的问题，或者是你没有办法自己来照顾自己，那到这个地步的时候，那要去住院。但是如果说你是在考虑就是 outpatient， 就像门诊去看一下心理咨询师之类的， there's really no lowest threshold when it comes to outpatient mental health care. If you've been thinking about it for a while, if you've been wondering about it for a while, you probably should just go. 不会说是你去看了这个咨询师，然后咨询说你小题大做，你没有必要 that shouldn't happen. You should be taken seriously. So if you've been thinking about it, you should check it out. But let me list the conditions for when you really should or when you must seek professional help. 当你有以下症状的时候，那就说你这个时候，或者说你家人这个时候就必须的去看 professional help 了。当你有自杀念头，当你有幻觉，当你有妄想，当你有这个化学依赖，包括酒精依赖或者是安眠药依赖，当你有反复的惊恐，像 panic attacks, repeated panic attacks， 当你的这些症状导致你没有办法进行正常生活，没有办法维持你的工作、你的学业，或者是没有办法维持这个 interpersonal relationship， 或者当你的症状导致各方面的 health conditions， 比方说就是持续的疲劳、持续的失眠、持续的头痛、胸痛等等。当你有这些症状，当他们持续不休的时候，那这个时候你就是really need to get professional help. Then some people may say, 我的 anxiety, you know, it causes me to withdraw. 有的时候我是睡眠不太好，但是这个我这一辈子就这样子了，我也没怎么的，对不对？而且我父母亲他们这一辈子也就这么过来的，这个也没什么大不了的，对吧？ You know, don't we all live lives of quiet desperation anyway? So what I think about this is, let's think about who else is affected by our quiet desperation. Maybe ask your family, ask your friends. I'm not saying this to make people feel guilty or shameful, but I think it's important for us to realize that mental health problems, they don't just affect us, the individual, but also people who are in our lives. You know, we can't really fully engage with other people. We can't really give to others when we're so depleted ourselves. And also, you know, because we're in the parenting club here, if we want our children to take good care of themselves, we really need to model good self-care for them. I can tell you in my clinical practice, so many of my patients tell me that they can't shake the memories of their parents' mental health struggles as they're growing up, and it really, really affected them. So again, I'm not saying this to shame or guilt anybody who hasn't gone to, get professional help, but I want to provide the perspective that this is an opportunity for you to advocate for yourself and an opportunity for you to help your children see that mental health issues are okay to have, they're okay to talk about, and it's okay to go and get help for them. And the other thing is, remember, for most mental health issues, the earlier you intervene, the better the outcome. If you wait until things are really, really bad, it gets harder to treat, and the treatment course may actually have to be stretched out a lot longer. So just because you don't have to, just because nobody is forcing you to, doesn't mean that you shouldn't. Think about what you have to gain and what you have to lose if you postpone care. In Chinese culture, as in many other ancient cultures, we have a tendency, I think, to not just accept suffering as a normal part of life, but even to glorify it. I hope I'm not offending anybody or cultural anthropologists when I say this, but for me, I was in China until I was 11, and I remember growing up learning 吃得苦中苦，方为人上人. A lot of Chinese students have endured a great deal of pressure in their academic life. So that feeling of stress and anxiety and that feeling of inadequacy, that's just part of life. It's so familiar. It's been normalized. 一个成语我就是小时候学到现在，我每次想到这个，我都觉得心里边不是滋味，就是悬梁刺股。就是我小时候学这个成语倒没有觉得怎么的，觉得很了不起，应该这样子的。但是现在作为一个心理医生 when I look at this, I have a different perspective. This is kind of self-abusive behavior. It's self-injurious, right? But when I first learned it, it was something to be looked up. It was accepted and even praised. So I think our perspective sometimes of what is okay and what is not okay, what's unnecessary suffering, may be a little bit off because of our culture. We may not as readily perform acts of self-care and to have compassion for ourselves. And we may fail to see that the pain we experience goes beyond normal pain of human existence and actually may be pathological. So when you're struggling with, is this enough suffering or not? Let's be honest and let's not dismiss our suffering. Okay, so perhaps instead of asking, should I get professional help? We should ask, why not? Why not get professional help? What's getting in the way? 为什么不呢? So from this perspective, actually, I think maybe it's helpful for me to kind of turn the question over to you guys. Maybe maybe our moderators, Alice, I think you could maybe share some 从你的这个观察，你的周围，你的朋友啊什么的。为什么有些人他不愿意去seek professional help？ 虽然他们 struggle 了很久，你觉得有哪些因素呢？
王莹医生，我觉得就是从我的周围的朋友和我的观察哈，我觉得我们中国的就是中国人呢普遍的就觉得mental health 好像是跟那个 craziness 相连的，就是如果去看 mental health 的这个医生，是不是就像有神经病啊，就是一种 humiliation 的感觉，是一种 embarrassment。其实呢，就像你说的mental health is so important to 我们的 life quality, not only to 我们 individual 的 life quality, 对我们家庭，对我们的孩子对我们的 spouse, 对我们的 marriage 都是有非常大的影响哈。然后我们现在的生活的 quality 已经不是像以前我们的父母一样了，就是他们就是在 survival mode。但是我们现在在北美生活，我们有这个条件可以看医生，为什么不能就是像 take care 其他的 organ 一样的 take care 我们的大脑的 health 是吧？我们的大脑 brain health is the most important part of the organ to direct 我们的 whole body 还有我们的生活的 quality 是吧？但是我觉得我们没有足够的重视，我们这个可能是从我们的文化来的吧，就是说觉得有一点 embarrassment， 就觉得去看mental health 好像有一点不好意思啊，所以呢我怕别人笑话什么。当然我觉得现在越多越多的人重视起来这个 mental health， 尤其是对自己的孩子的 mental health 非常重视。但是我觉得我们也应该重视自己的 mental health， 就像你说的，要 set a good example to 自己的孩子哈，重视自己的 mental health， 重视自己的家庭，自己的 marriage 的 life quality， 这样子才会给孩子一个 happy 的这个environment 是吧？还有 memory 对他们来说也都是非常重要的。
我觉得你说的太好了。Yeah, and I think you made very, very good points. 你一开始就说觉得好像 there's a stigma， 觉得去看就是mental health 好像就是我有精神，就是 I'm crazy, you know, unless you're crazy, you don't go to see a psychiatrist or a psychologist. 那么 as a psychiatrist, I can tell you, I have some patients who are so successful. You know, they're not crazy at all. And even if somebody comes to see me with psychosis, 就是我们说的精神分裂症啊，或者有幻听、幻想、妄想啊。So what? You need to get treated, and you can still live a very meaningful and fulfilling life if you get it treated. But by all means, not all mental health illness is the same. Not everybody that comes to see a psychologist or a psychiatrist is crazy. There's a whole range of different types of mental health conditions.
对
So we need to do a lot to kind of break free from that stigma.
对，我听说其实有很多比较有条件的北美家庭，就是Caucasian 吧，他们会就是很 healthy 的状态，他们也会 periodically 去 check 他们的这个心理医生，其实这对他们的生活和工作的事业上的成功也特别的有帮助。他们有他们的 life coach， 有他们的心理医生。他们 periodically 去见他们就会得到很多的帮助哈。我觉得这个很重要。其实我们北美的很多家庭就是 Asian 家庭也是有这个条件的，因为医疗保险也有这个，比如说每年20次啊、10次啊都可以去看哈或者是 out of pocket 的。但是我觉得我们就是应该重视起来，因为觉得自己的孩子 deserve everything， 我们也 deserve everything 是吧？我们也 deserve a quality of the life。还有自己的 mental health， 只有你 mentally strong， 你才能就是 defeat 生活中的所有的 challenge。所以 appreciate 王莹医生来给我们分享这么多非常好的干货满满的。继续。
So I'm not crazy is like the first one that I thought of here. We kind of talked about that. 有些人也会觉得就是说我现在这种心情的不爽是因为我的生活里边有各种各样的问题 life circumstances. 你去看医生或者去看一个 therapist， 他们就是跟你谈话吧，或者给你写药吧，他又不能改变任何的，不能解决问题，不能改变我的 circumstances. So I think this is actually an important point to make. You know, life circumstances can sometimes be very difficult, but same circumstances can affect different people differently. When somebody is very depressed, they may not be able to manage stress the same way that somebody who's not depressed may be able to manage. You know, so even if you're under severely like harsh circumstances, if you're mentally healthy, you can find ways to withstand that, and it doesn't have to turn into a tremendous amount of suffering. You can withstand that pain. But if you're not mentally strong, you're not mentally healthy, small adversity can turn into huge disasters. And, you know, a doctor, a therapist may not change your life circumstances, but they can help you develop healthier coping skills. They can help you better cope with the stresses in your lives. So, you know, we can't change your life, but we can help you find ways to manage difficult life circumstances. Some other things I think, you know, we'll cover later on. You know, people are afraid of medications for good reasons. There's financial barriers. We'll talk a little bit about that. It's time commitment. We don't know how to get started. Talk about that a little bit. And some people told me, I've tried it a couple of times before, didn't really help. I don't think I'm going to try it again. 这个呢也值得提一提，因为 to find the right person for you, sometimes you have to try it a couple of times. 就像我们 dating 一样的，也许第一次就是出去 date 和这个人 chemistry 不太 match. 那 it's okay. You don't have to give up on your love life forever. You can try again. Kind of the same thing with a psychiatrist or a psychologist. Just because 这个人的 credentials 很高，不代表他一定就是 the right person for you. So maybe you need to try it a couple times to find the right chemistry. So what if it's not us, but a family member who needs help? How do we open up that conversation? How do we get them involved? I want to start with what not to say. I'm sure these things, none of you guys would talk this way. I don't know. But just to demonstrate this point, I want to read some of these things to you. 我觉得好像特别的过瘾，这样子讲话。What not to say. Lecturing. 年轻人不要这么多愁善感，你不要那么敏感好不好？或者说你就这么一大把年纪了，你这么逞强干什么呢？ 或者 blaming or shaming， 你看你这样自暴自弃，你浪费多少宝贵时间？你这样对得起父母吗？好吧，那我真的是对不起任何人了，对不对？或者是 minimize， 这点挫折算什么呢？你看你这点挫折都没有办法 handle， 那我可能什么都没有办法 handle 了。或者 make assumptions， 你不要担心你面试会失败，失败没有什么可怕的，不可怕。那你怎么知道这个人他是害怕失败呢？也许他担心的是他成功了，然后他成功之后他不知道下面一步怎么走，所以我们不要 make assumptions。cheerlead， 你不会失败的，我老公是最强的。这个听起来好像是信心满满的，但是 the problem is， 也许你老公这个时候真的没有那么强大，也许这个时候他需要的是 permission to fail， 所以说不要再给他压力。或者是 compare， 人家不也是考试吗？你至于像你这样子吗？那人家都能 handle， 我都不能 handle， 那我肯定真的是 worthless。所以说 this is what not to say. And when we look at it like this, it's kind of funny. But some of you may be thinking, oh, I speak like this sometimes, or maybe you may be thinking, this is how my parents spoke to me. What's the big deal? I don't deny sometimes words like these are actually okay. 对于有些人来说，这样的语句可能还会让你感到亲切，因为我们可能成长在specific cultural context， 已经习惯这样子讲话了，或者我们内心比较强大，我们知道家人和朋友他的出发点是好的，所以具体怎么样包装可能不是那么重要，重要的是我们能感觉到那份关心。所以如果你曾经这样子去说家人，也不要太自责。但是呢，我们还是要了解我们自己的文化背景和其他人的文化背景不一样，和我们孩子的文化背景也不一定一样，或者呢，我们自己可能内心比较强大，能 handle 这个，但是也许别人这个时候内心不那么强大，所以你怎么样子说话还是 make a difference。所以一方面我们不要自责，总是有机会来弥补的，但是同时也要知道我们是要不断进步的，对不对？人总是要不断进步的，所以我们现在来看一看怎样更好的来进行这样的对话。So how to help family and friends who struggle?First, we need to find an appropriate time and place. Consider a private setting with limited distractions when you have one-on-one time, when you're at home or maybe on a walk, so there's not a lot of distraction. We express concern and we talk directly. 为什么要直接的呢？为什么不转弯抹角呢？我觉得呢，就是 when we're direct, we give people permission to directly talk about what they're struggling with. We make it okay to talk about these things. Direct doesn't mean harsh or insensitive. It just means you don't have to beat around the bushes and make it seem like this is something we can't talk about. If you see that they're struggling, you can point out that you see they're struggling. You can use words like you seem depressed, you seem worried. Part of what we want to do is to help them see that these things are okay to talk about, that we can talk about them without judgment.And then it's very important that we ask. We don't just talk. We ask how they're feeling. We ask how they see the situation so that we can understand. And then we acknowledge their feelings and we listen more. We ask more. I think, Jingshan and people that are involved in nonviolent communication are already masters at this. But this is just kind of a reminder. We ask, we acknowledge, we offer help, and we offer reassurance that these things are treatable.And we offer them help to find resources. And then most importantly, we need to be patient and recognize that not everybody is ready. Even if we push, not everybody is ready for that. And they may push you back when you first try. And that's okay. These things don't happen overnight. The important thing is that you have started this dialogue and then you can continue to reach out with offer to help and with offer to listen.So with that, 我想请景山给我们展示一下怎么样用 non-judgmental observation， 怎么样子用showing concerns directly。景山你可以读上面的，或者用你自己的方式也可以来跟我们分享一下怎么样子来进行这样的对话。
说最近几个星期都没看到你笑，你好像压力还挺大的。你看上去是不是有些焦虑
Non-judgmental observation, we're just making observations right now. 然后 express concern directly.
我担心你现在的状态，我感到这样下去你可能会撑不住。这个地方担心有的时候也可以说我很关心你。 如果是对方，有的时候对方可能不好去面对，先表达一下关心，可能。
可能你是不是觉得，如果你说我担心，会给他一种负担，就是说这个时候我不想让你担心，所以我就没有办法来流露自己真正的这种状态，就是不要给别人一种压力，是这个意思吗？
是啊。
OK，
可能看情况了。
对，然后
在stage 上
seek information，
发生了什么事吗？你感觉怎么样
？So we're asking, seeking information， 然后 acknowledgement。
这是真的挺让人难过的。你心情不好有一阵子了，是吧？还真让人着急啊。看得出你很纠结。
然后 offer help，
我能做些什么帮到你吗？愿意再跟我说说吗？心理的痛苦也需要治疗的，我们找心理医生好吗？我帮你联系。
Okay, thank you. Thank you. 如果大家有其他的想法，或者是这方面有自己的这个ideas 的话，也欢迎你 you can type it into comment box. If you have any questions, feel free to ask. Okay, so I'm going to continue for now. So let's say we've decided to seek mental health care. I want to give people a little bit of an overview of what's there, what's accessible. So mental health resources here. In terms of mental health care, there's kind of a range, a spectrum. On the one end, you have 就是门诊 routine outpatient, and on the other end 比较严重的就是 inpatient 住院治疗。So my clinic 我自己的诊所是 outpatient clinic， 在我的这个诊所里边，如果说是来做 medication treatment 的话，一般是 it depends。如果是刚开始在调整药剂量，然后 trying to control symptom 的时候，见面的频率可能是比较频繁一点 ，maybe every 2 weeks, every 3 weeks。达到维持阶段的时候，当这个剂量已经很平稳了，症状也已经有了一定的控制了的时候呢，可能 every 3 months， 每3个月做一次 kind of check in。如果是做谈话治疗 therapy 的话，这个 frequency 也是varies。一开始可能会频繁一点，像 weekly 或者是 every other week 是 usually where we start。然后当渐渐的我们reach a point of stability 的时候，那可能 stretch out the time between meetings. Sometimes people do monthly check-in. 也有一些我的long-term clients, they're doing very, very well. They're very high functioning, and they want to check in, kind of as a reminder to do a kind of mental health checkup. And so maybe I see them once every 3 months. That's not very frequent, but that happens as well. I think Alice kind of mentioned, some people they're doing well, but they want to kind of routinely maintenance check-in. So I do some of that as well. So this is outpatient. And then, between outpatient and inpatient, there's also what we call IOP, intensive outpatient treatment, and partial hospitalization. 就是这个是介于 outpatient 和 inpatient 之间的。You don't stay overnight in these programs. For IOP, intensive outpatient, usually 一个星期去2到4天。每次去的时候大概3个小时。In these settings, usually there's a lot of group therapy. So you're sitting there with a group of other people and kind of learning skills together. You may see a psychiatrist, but usually you see the psychiatrist maybe once a week or maybe once every other week. And then a little bit more kind of higher level partial hospitalization. Usually people go 5 days a week and it's a longer day, 5 hours a day. Again, a lot of group work. And you see the psychiatrist maybe once a week, once every other week. And then on the other end of the extreme is inpatient, where you're monitored 24/7 and you can't just leave. So there's a range of different services. So I want to talk a bit more about 门诊，就是 outpatient care. There's different types of outpatient care. If most people, I think, if they have the resources, 有这个resources 的话，可能会 start with 私人诊所。In a private office, you're usually dealing with an individual doctor or an individual therapist. It's more of a small and intimate setting. And, usually the office looks kind of like somebody's study, and there's comfortable couches and you sit right across from the therapist or the doctor. You try to make yourself comfortable and you just talk. In a community mental health 社区诊所 in that kind of setting, it's a larger organization and usually there's many more staff members. There may be some doctors on site, but usually maybe 1 or 2 doctors, but many therapists. There's also maybe case managers, social workers who, their role isn't to do therapy, but to connect you with other resources. And there may be peer advocates. So community center is able to provide more comprehensive care. If you're not familiar with the mental health system, they may be able to connect you to different resources in the community. The environment itself may be a little bit less cozy than private practice, but nevertheless, it's a very valuable resource. And people that utilize community clinics, they tend to not have as much resources. It tends to be more lower cost. Sometimes it's even free, but it's still an extremely valuable resource. And if you're looking for more comprehensive care, by all means, community mental health is a very good place. Multi-specialty group medical practice. So by the way, I've worked in all these different settings, and I can tell you all of them have their own advantages and disadvantages. Multi-specialty group 就是比方说我们这边可能有 Capital Health， 它这个 group practice 可能有各种 specialty， 可能有 OBGYN， 有 cardiology， 也有 mental health. Mental health is one of the many services that they provide. The problem with this is that the doctors come and go. So there's usually not a lot of consistency, and it may be very difficult to get into one of these groups. But if you're able to, that's also a good option. Primary care doctors, 家庭医生, they actually can be a very helpful resource. 当你没有自己的这个心理医生或者 therapist 的时候, primary care doctors can prescribe some basic psychiatric care, even counseling, but they can also prescribe some basic medications, and they can provide referral. If you're a college student, there's usually college mental health services on campus that can provide both emergency kind of consultation as well as kind of limited outpatient therapy. So that's something to look into as well. Okay, I won't spend too much time here. I already kind of went through some pros and cons of different settings. Again, private practice, generally you have more one-on-one attention. Generally, the sessions are longer, but it tends to be pretty costly. You may have to wait a long time before you can get in to see a doctor. And usually you're just working with one doctor, at most maybe a doctor and a therapist. There's not a large team. Community clinic, it's usually very affordable, and you may have more resources, but the sessions are usually shorter, between 15 to 20 minutes if you're seeing a psychiatrist versus 30 to 60 minutes if you're in a private practice setting. And the physical setting may be a little bit less comfortable. And then primary care, it's easy to access, but they don't have specialized training. They're a good place to start. And then people also ask me, what's the difference between a psychiatrist, psychologist? I think most of us, know the difference, but just to summarize, they're both experts in mental health and they can both provide therapy. So I do psychotherapy, but I'm also a medical doctor. So I went to medical school and then I did, 4 years of specialized training in psychiatry, doing therapy, doing medication management. So I approach things from also a medical perspective, and I can write medications and order labs. Psychologists, they have expertise in addition to therapy. They are also very good at doing evaluations and testing, which I don't do. So if somebody wants to do a specific testing for autism spectrum disorder, or they want to do testing for ADHD, I will often refer them to a psychologist to do this kind of testing. They do not prescribe medication, but they have advanced degrees. They're PhDs or PsychDs or educational doctorates. And a lot of them are very well versed in specific types of therapy modalities and have experience in doing research. So where do you start looking? Maybe start with your insurance company. If you want to use insurance, call your insurance company to get a list of in-network doctors. Keep in mind, this list is usually not very accurate, unfortunately. If you do call your insurance company, ask if they provide case manager. If there's a case manager, they may be helpful in maneuvering the system for you. Also ask if you have an employee assistance program. Some employees offer that, and they may cover the cost for the first couple sessions that you'll have. Not everybody has that, but definitely ask. Psychology Today is a very useful resource. You can go on there and you can search for a therapist or psychiatrist. You can filter by location and insurance and a lot of other factors. You can go to your primary care doctor and ask for a referral. Campus mental health services I've mentioned. Another thing for people that can't find a private practice doctor, you can consider online doctor options. So there's Amwell. I actually worked for Amwell for some time. Just Google Amwell and then you'll be able to find their database of doctors, and they do take a lot of insurances. Also, there's one called Teladoc, and then there's also one called Better Health. I think Better Health is just for therapy, but Amwell and Teladoc also cover medication treatment. For people that don't have as much financial resources, I've listed some resources on here. Maybe later, my slides will be available. You can go to these sites, but typically you want to search your state department or state's Department of Human Resources for free mental health care. Some insider tips. There's a shortage of psychiatrists, as you guys may know. So a lot of times when you try to get in, you may be put on a wait list. The wait list could be many months long. While you're waiting, ask them if they have a cancellation list. I do this a lot. So if somebody cancels, then I call people on the cancellation list. I may be able to get them in a lot sooner. So ask to be on the cancellation list and checked frequently. When you're trying to decide which doctor or which therapist to go with, ask them, how long are your sessions? Are they going to see you every time, or are they going to have, a physician's assistant seeing you or someone else seeing you? Ask them, how do you communicate between sessions? Some doctors give out their numbers, some doctors give out their email addresses. So, find out how they communicate with you and see if that's acceptable. Confirm their credentials. You can check to see if they have a valid license number, if they have a valid NPI, where they graduated from. These are important, but also remember, credentials themselves don't mean everything. Sometimes a lot more important is, what's the chemistry like? Do you have good rapport? Do they seem to be nice? That's really important. And also keep in mind, it's okay to switch providers. Sometimes you need to try a couple different ones. Sometimes you need to call a couple different ones to get a sense of what are they like. And it's okay to be picky. The other thing that's kind of important to remember is you may actually feel worse before you feel better. Think about it. When you go to a therapist, you're forced to confront things that are difficult to confront, right? So in that process, feelings are stirred up. So in the beginning, it may actually make you feel a little bit worse, but the goal is that you'll eventually feel better. So what does an appointment look like? Just very quickly, if you go to a private office, like mine, you start in the waiting room where you sit, and you don't go and knock on the door. You sit in the waiting room, because if the door is closed, it means the doctor is with another patient. So you wait, and then when the doctor is ready, they'll come and take you into their office. And then once you're in their office, make yourself comfortable. The sessions typically in a private setting are 30 to 60 minutes. My initial evaluations are usually 60 to 90 minutes. And during that time, I'm not necessarily doing treatment. I'm trying to get to know you and make a diagnosis. And then we come up with a treatment plan. And usually the first meeting doesn't mean that you're going to work together. It's a chance for the doctor to assess you and to come up with a treatment plan. And it's a chance for you to assess, is this doctor somebody that you want to work with? So the initial visits are usually longer. Follow-up sessions, for me, 30 minutes for medications and 50 to 60 minutes for therapy sessions. Once the meeting is over, you make your follow-up plans. You decide, when am I going to come back? The doctor may write a script for you. They may also write labs for you to rule out medical conditions. I'm not going to go into details here, but just remember, psychiatrists, sometimes they also want to look at other aspects, not just mental health, but physical health. So do we do meds? Do we do therapy, right? For me, I think it really depends. Depends on your diagnosis, 你的诊断，因为有些诊断它是用药是必须的，比方说，像 bipolar 双向情绪障碍，像 schizophrenia 精神分裂症，像这些病的话，光用谈话治疗肯定是不够的。如果诊断是抑郁症、焦虑症强迫障碍等等，这些我们要看 symptom severity。如果症状比较轻，工作和生活还可以进行的话，一般我们建议是先从谈话治疗开始。如果已经比较严重了，影响到生活了，那么药物治疗就有必要。药物治疗和谈话治疗它 并不是相对立的。很多人他用了药物以后，他能更好的参与或者利用这个谈话治疗，因为谈话治疗它需要你有一定的这个参与能力和吸收能力。当你特别抑郁、特别焦虑的时候，你对事情的吸收能力会受到影响。所以呢，有的时候是 we have to use them together。当然呢，我们用药的时候，用药物治疗的时候，需要定时 reassess， 看看有没有副作用，有没有起到我们所期望的效果，衡量一下它值不值得继续，剂量需不需要改变等等。不能否认，我们确实要考虑药物在帮助我们的同时，会不会给我们带来一些不利，这个一定要跟你的医生谈。然后呢，不同的药它会有不同的副作用，有些药它是可能会有依赖性的，但是大多数常用的精神药是没有依赖性的。容易产生依赖性的药通常是安眠药、镇静剂等等，这些药呢确实应该少用，不能长期用。但是绝大多数的精神药物，比方说抗抑郁症的情绪稳定剂、抗精神病药，这些药没有依赖性。那么大多数副作用是在开始用药一开始头7到10天会比较明显，比较常见的 side effects 包括头痛、肠胃不适、瞌睡这些。那么这头7到10天过去以后，一般大多数人他都会这些副作用会渐渐的减缓或者是 disappear。都会能适应的，但是可能会有一定的过程。那么你应该及时的和医生沟通，反映你对药物的感觉。如果副作用太大了，可以把剂量调小，然后减缓这个加剂量的速度。如果副作用太强的话，也可以换药。那么有些副作用是一开始你能感觉到的，也有一些是用了一阵子以后才会产生的。所以呢，我们要定期的复查，然后呢，定期的检查一些指标。像我一般是每6到12个月会要求病人去查一下他的胆固醇、血糖等等这些指标。在用药之前，一定要和医生好好的交流，问清楚了哪些短期、哪些长远的这个副作用需要 monitor 的。还有一点值得讲的就是，每个人对药物的反应不一样，并不代表说别人有这个副作用你就一定要有。你对副作用的反应一大部分取决于你的这个基因的结构。亚洲人对药物的承受能力和对药物的代谢和白人比起来是有一定的差别的。Asians tend to be actually more susceptible to certain types of side effects because of being poor metabolizers of certain antidepressants and certain mood stabilizers。这并不代表说亚洲人就不能用这些药，但是呢，我们可能要更关注我们的反应。有些药呢，我给亚洲病人开的时候，我会非常的谨慎，开始剂量会比一般的人要小，然后 titration 会比较慢一点。OK， 那我们刚才谈的就是
大部分药物其实是没有这个就是人种上的问题的。
对，大部分是没有的。couple， 一个是 Lexapro、Celexa， 这是有一些，还有一些这个 mood stabilizer， couple， 大部分是没有的。对，你说的是对的。OK， 那这个谈话治疗又是怎么一回事情 ？What does it involve？ So， 第一个，它是一个这个倾诉的渠道。当心理问题被说出来的时候，它本身就有一定的治愈的作用。It's like when you have a pot of boiling water, when you lift the lid and let it out, the pressure is relieved. 所以就是谈话本身它就是一种治疗。当你的痛苦被看见的时候，痛苦本身也会有一定的减轻。但是一般来说，我们的谈话治疗不仅仅是倾诉。Sometimes therapy can be used to help people develop coping skills like mindfulness, relaxation techniques, grounding techniques. 我们可以通过 therapy 学会怎么样放松自己，不那么暴躁，怎么样平息自己情绪。然后更进一步呢，谈话治疗可以帮助我们发现自己思维模式是不是出了问题。往往我们的痛苦并不是来源于真正的苦难，而是来源于我们这个思考问题的方式，我们对事情的理解。所以这个 therapist has a role in helping us examine our own thoughts, our thinking style。然后呢，帮助我们发掘更加健康的、智慧的思维方式。Another big part of therapy is examining our relationship dynamics. 我们对人和事的看法，以及我们和别人交往的方式和这个 relationship dynamics，往往来自于我们原生家庭对我们的一些影响，以及我们的人生经历。所以 therapy will often involve us examining important relationships, the way we grew up, how we view our relationships, and how we form relationship dynamics. Through these kind of examinations, we can form healthier relationships and more effective ways of being with other people. So talk therapy isn't just limited to these things that I've mentioned here, but I wanted to give you kind of a bird's eye view of what talk therapy is about and what it aims to do. So there are different types of talk therapy. And as I mentioned, today I want to focus on CBT and DBT, in part because the principles of these therapy modalities can be applied without a therapist. 你就是没有心理咨询师或者是心理医生的话，你也可以自己应用一些这里边的 technique.